Hello, my name is Ben Cobb, and my mentor's name is Jerry Jose. I chose this topic of athletes in high altitude due to my niche interest in aerospace medicine. I wanted to observe changes in performance and health like blood pressure and heart rate. In endurance athletes, there are three possible methods of high altitude training. Now, has anyone ever thought why Olympic runners and cyclists train in the mountains? This is due to the proven success of high altitude endurance training. There are three methods, including the live high, train high method, which involves the competitor exercising and residing at a certain height for the entirety of the procedure. Other methods include the live high, train low method or the low, train high method. At the end of the test, the athlete's endurance, personal best, muscle strength, and finally oxygen saturation are retested to seek a difference. The ideal altitude for these tests is proven to be at a height of around 2,500 meters and lasts about 3 weeks. Starting with the live low, train high method. This was considered the least consistent and the least beneficial for the endurance athlete. There seemed to be more of a neurological benefit than performance. Also, in doing this procedure, many tests show that it leaves the individual with sleep trouble and higher risk of illness from the change in altitude. More on that later. However, in all, there are still some little improvements in personal best and stamina. Next is the live high, train low method. In using this method, it is seen to improve swimming, running, and cycling. There were significantly more benefits than the previous method. However, not many advancements in time travel were seen. Finally, the most effective method is the live high, train high method. The constant exposure to the hypoxic condition and the surrounding loss of oxygen causes the body to produce erythropoietin. This hormone stimulates the synthesis of red blood cells in bone marrow. This process is called erythropoiesis. There will be a fascinating increase in performance when the body returns to low altitude. Additionally, the blood parameters will increase significantly compared to the starting test on day one. Hematocrit increased vastly, and heart rate decreased during the recovery periods. All this information creates a strong, confident answer to every endurance athlete's question: will altitude training improve my results? The answer is an assured yes. However, before attempting altitude training, one must realize that there are extreme complications in order to complete it. The dangers of altitude training may result in a weak cold, or if done completely wrong, death can occur. With supervision and a concrete, safe plan, altitude training can be harmless and effective for the athlete. Major illnesses that can occur include acute mountain sickness, which causes headaches, fatigue, or nausea. More include chronic mountain sickness, which arises from long-term oxygen deprivation, or high-altitude pulmonary or cerebral edema, which may include fatal immune suppression, dehydration, or even sleep disturbance. Keeping all of this in mind, high-altitude training is effective for the endurance runner and will, without a doubt, improve them in all forms of their particular sport. Athletes should consider altitude training whenever attempting to improve. The live high, train high method is the most effective for the athlete and will improve the performance and the psychological effects in the endurance athlete. If done safely and with the right preparation, supervision, altitude training, especially the live high, train high method, will give the athlete the edge above competitors, psychologically and performance wise.